Joining me now for the latest on COVID-19 in our region is Medical Officer of Health, Dr. Paul. Welcome back to the show, Doctor.
Good to be back.
All right, so let's start with the big news. Our neighbors in South Glengarry are certainly seeing an outbreak, but we should clarify as well, those numbers were initially listed in the city of Cornwall, so maybe you can explain kind of what went down with that situation.
It is one outbreak of at least 40 cases, and it's located, really the building address was initially located as a Cornwall address, but it is not. It is actually it's an SDNG, so that's why we moved it around. And it's really in one outbreak itself. It's not scattered, so I want people to know that.
Excellent. That's reassuring. But at the same time, it shows that in a congregate living setting, how fast the virus can spread.
Exactly. And then it's very important again for us to be careful that when you're going into a congregate living setting or any other workplace, whatever, you could bring it in, and if there's a lot of people there, you could get a lot of cases.
Absolutely. Now, our numbers have sort of fluctuated over the last couple of months. October was a big month in our region. A lot of increase in cases. Things seem to be kind of sliding in November. Now things are on the uptick again. And of course, the announcement today that our region would be returning to orange.
Yes, due to the numbers, again, we look at these numbers on a weekly basis, and we also don't only look at the case numbers, we're also looking at the rate of positivity of our tests. We're also looking at what's called the reproduction number, which in our situation is 1.5. So all of those three indicators are putting us really in the orange territory based on the new framework. And so on Wednesday, we had a discussion with the Chief Medical Officer of Health, and he asked me and he recommended that we go into orange, and I agreed. And so today the announcement was made. So as effective Monday morning, we were going into the orange zone, which we've been there before. It is not that much different in terms of, actually it's not different in terms of gathering. So the gatherings are limited to 10 indoor and 25 outdoor. We're still telling people to stay home, with their own family, not to mix with others. But there's going to be a bit more restrictions in restaurants and gyms and movie theaters. But nothing is closing at this point. However, I want to tell people that we were at some point, because of those numbers going high, we're actually close to red territory, and red territory is closures. It's much more decreased gatherings and so on. So we don't want to go there. I want to go the other way. I want to go yellow. But now that we're in orange, I think we should just continue with what we're doing. And I'm confident. I'm starting to see today's numbers going down a bit. So hopefully that trend will continue over the next week or so.
Absolutely, and a little update as well on some outbreaks within the city of Cornwall. They seem to be under control, but we do have currently, I believe, 4 long-term care homes that have had cases.
That's right. Again, you have to look at where we get the cases. So the good news is that this is mostly staff that we test regularly who have no symptoms and are tested as part of our surveillance. So out of precaution, in some of them, I think it's 1 staff, and another one it's 2 staff. We actually declare the outbreak because we want to be ultra careful. So we don't have any residents in those areas, in those homes that are positive. At this point, we're testing everybody. We're doing the whole protocol. We're treating it as if it is an outbreak, so we can make sure that it doesn't spread at all. And that's why. So the good news is that there's not many cases. Actually, there's no cases of residents, but it's just part of our surveillance. And out of being very careful and very cautious, learning from what we've learned in other long-term care homes, that's why we declare them into an outbreak, to really have that heightened sense of protection and precautions in place.
Absolutely, and we know that without that caution, things could go south very quickly. So we're definitely grateful for that. And Doctor, this is our last update before the holidays. I'll give you the platform now to discuss to our region, our viewers, basically the recommendations for Christmas gatherings or any holiday gatherings.
Thank you. So first of all, I would like to thank everybody for really stepping up to the plate. I think our population in general, Cornwall, SDNG, even the whole area that we serve, has really understood our messaging, has followed our public health measures, and have really done an excellent job in most parts. There are people that don't believe in the pandemic or don't believe in masks, but for the most part, we have. I'm very proud of what we've done in our area, and People asked me, some other media asked me yesterday, are you discouraged because you're going into orange? Well, yes, I would have liked to stay in yellow and maybe go to green. However, what we're seeing several health units went into lockdown today, and others went up a couple of zones. And across Canada, across the United States, across the world, this second wave is actually much bigger than the first wave, and that's how these viruses behave. So it's although I'm frustrated that we're going into orange zone, I'm actually seeing a bit of a light at the end of the tunnel, because we've done what we can, but we can continue doing it, and particularly over the holidays, where you can we usually celebrate with our families and friends. Unfortunately, this year, just a bit longer, really. Vaccines around the corner. We're recommending stay home, stay with the family that you live with. Do not receive anybody. Do not travel. Do not go out of our region. Do not receive people from out of our region. And stay safe. Look at virtual ways. There are alternative ways of being in touch with your loved ones. And like I said, I believe that the light is at the end of the tunnel. And I wish everybody happy holidays, Merry Christmas, and a happy and healthy 2021, which I think will bring us to the end of this pandemic or close to it.
Absolutely. We certainly look forward to that. And of course, a Christmas holiday with some temporary sacrifices for some big gains, and an issue that's certainly life or death. So we want to thank you, Doctor, for all your hard work this year. And we look forward to continuing to update viewers in 2021.
You can count on that. Thank you.